views onto the heart from the parasternal plane, and we may have to compensate by moving the probe up one or down one position to gain the best views of the heart. Here's the parasternal long axis view in action. Note the great view of the heart on the screen. The parasternal long axis view of the heart probably gives the most overall useful information about general cardiac dynamics and can be very instrumental in general emergency care. To convert the parasternal long axis view of the heart to the short axis plane, cardiologists to gauge ejection fraction. Now, despite our best efforts, it can sometimes remain difficult to get good views of the heart from the parasternal position with the patient recumbent. So a pearl here is to position the patient in the left lateral decubitus position. Now this will pull the lung off of the heart and may improve our views from the parasternal position. Note here, the probe is now placed into the parasternal long axis configuration, and note the great view of the heart on the screen. And here I'm just moving the probe into the short axis plane 90 degrees clockwise to convert to the ring or donut view of the heart.
Simply called the parasternal long view. To acquire this view, the transducer indicator is aimed to face the patient's right shoulder. From the perspective of the sonographer, we will now demonstrate the relationship of each of these three views. The parasternal long view will be our starting point. The transducer is tilted towards the patient's left shoulder to allow the acquisition of the right ventricular inflow tract, or RVIT view. Notice that the indicator is still pointing towards the patient's right shoulder. Finally, and starting again from the parasternal long view, the transducer is angled towards the patient's right hip to acquire the right ventricular outflow tract, or RVOT view. Notice that the indicator is still pointing towards the patient's right shoulder. Now we will look at each view to demonstrate the anatomic structures visualized. Notice that in this parasternal long axis view, the aorta is labeled in both the animated heart and the clinical image. On the left image, we can see how the parasternal long plane cuts the aortic valve, labeled AOV, and the mitral valve, labeled MV. The left ventricle is labeled LV and the left atrium LA.
Your esophagus or food pipe. In order to help relax the muscles in the back of your throat and help open up the passageway, you will need to take slow, deep breaths. You will then be instructed to put your chin to your chest and open your mouth. As the doctor begins to push the tube in, you will be asked to swallow. Swallowing makes the tube go down more easily. If you gag when the tube enters your food pipe, the nurse will spray more numbing medicine on your throat to decrease your gag reflex and make you more comfortable. Your doctor will insert the tube 14 to 18 inches down the length of your food pipe. A nearby video screen will confirm that the tube is in exactly the right place to create images of your heart. The actual procedure takes about 15 to 30 minutes. When the test is done, your doctor will slowly pull the tube out through your mouth.